The gut microbiome is a very complex, dynamic community of microorganisms that we find in the gastrointestinal tract. This includes bacteria, it includes viruses, fungi, amongst others, and it is constantly communicating and working alongside the host. It plays a number of key roles, so it helps to digest and break down food that we eat. It helps to educate our immune system, for example, and fight off pathogenic or bad bacteria as well. So it's really integral to overall health and well-being. The gut microbiome, I think, is being recognised more and more to play a significant role in sports nutrition. We know that the microbiome is going to be involved in energy harvesting, so that's going to be involved in providing energy and fuel to our athlete. It's going to be involved in supporting the integrity of the gut barrier as well. It's going to be involved in perhaps the immune response and making sure that our athlete is capable of fighting off opportunistic infections like colds and flus and things. And also it may be involved in sort of modulating stress and cognitive function as well. When we then think of what exercise does to the gut, we know that when athletes and exercisers start very long duration exercise or very high intensity exercise, we get redistribution of blood away from the internal organs to the working muscles. And in doing so, we then know that what happens is that the gut responds unfavourably. So we have an increase in almost like a hypoxic type environment, and it's called splanchnic hyperperfusion. So this is a reduced oxygenated blood flow to those internal organs. And so we get a breakdown in this gut barrier. So things that should have stayed inside our gut, all of a sudden those type of things sometimes can translocate out of the gut into circulation. And that can increase inflammation. It can be a cause of some of the sort of gastrointestinal symptoms that athletes may suffer when they exercise. So things like nausea, stitch, and sort of that feeling of cramp and stitch in the stomach as well and things. And that's going to impact performance. We know that team-based athletes like football and rugby union, these type of athletes and these competitions are occurring more and more in hot climates as well. So what we wanted to investigate was to see whether, if we mimic a football match in a hot environment before and after a dietary prebiotic intervention, whether we can influence the immune response and the gut response to that exercise stressor. So we recruited male football athletes to take part in this study, and they were randomised based on age and body mass to receive 6 weeks of one of two interventions. So these athletes either received 6 weeks of Bimuno galacto-oligosaccharides, so our prebiotic intervention, or they had a taste and appearance matched placebo, so it was a randomised double-blind intervention. At day 0 and day 42 of these interventions, we brought the athletes into our environmental chamber here at Nottingham-Trent University, and we put them through what's called the football-specific intermittent treadmill protocol, which is essentially a protocol on a treadmill that mimics a football match. So they did that at 33 degrees and 50% relative humidity as well, so we've got that added environmental stressor as well. During and after that 90-minute treadmill protocol, we took measures of blood and saliva, and during the exercise task itself, the athletes were also reporting GI symptoms. Those athletes who had been taking the Bimuno galacto-oligosaccharide for 6 weeks actually demonstrated a reduction in the increase in intestinal fatty acid binding protein in response to that football protocol in the heat. So no longer was the gut being as permeable or as leaky, if you like, following that exercise stress. At week 6 as well, we also were able to see increases in the secretion rate of salivary immunoglobulin A in those athletes who had been on the prebiotic as well. So again, that demonstrates that maybe by using the prebiotic to target the microbiome, we're actually influencing overall host immunity. If they've been on the prebiotic for 6 weeks, the duration of an opportunistic infection like a cold or flu type infection was reduced by days if they'd been on the prebiotic compared to the placebo group. And also during the 6 weeks themselves, there was an attenuation in GI symptom severity. In our previous work, we did a 24-week prebiotic intervention in in rugby union, and we were able to demonstrate improvements there in terms of the duration of illness was reduced and GI symptoms were reduced. But what we've been able to demonstrate for the first time now is that actually during exercise itself, we've been able to demonstrate that if athletes have taken a prebiotic, we can reduce those GI symptoms during the exercise task. And we've also been able to support our previous work in terms of reducing the duration of upper respiratory tract infections and reduce GI symptoms in these athletes.